and welcome to another series of talks entitled Understanding Diabetes. My name is Desmond Croker, registered nurse and Caribbean certified diabetes educator. This series of talks comes to you with the compliments of Annie's Memorial Chronic Disease Education Center. Today, as promised in our last video, we will be discussing type 2 diabetes. Type 2 diabetes is a condition where sugar in the form of glucose accumulates in our blood. This sugar comes mainly from the food that we eat. About 90% of persons with diabetes have type 2 diabetes. When we eat our food, all the carbohydrates in our food, not only the things that taste sweet, become glucose. It turns to sugar in the form of glucose. If I were to ask you, give me some examples of carbohydrates then, I'm sure you would be quick to list things like flour, sugar, rice, cereals, ground provision, cake, ice cream, chocolate, and the list will go on and on. However, did you know that carbohydrates also include foods like milk, carrots, pumpkin, beet, coconut water, and oats? You may be saying, aren't carrots, pumpkins, and beet vegetables? Oh yes, they are vegetables. But they also have carbohydrate properties in them, and as a result, they produce glucose in our body. This glucose must then be converted and carried to our cells by a hormone produced by the pancreas called insulin. Glucose is the source of fuel that most organs of the body prefer to use for energy. However, it is only after glucose gets into our cells that then is the only time it can be used to produce energy, after it gets into the cell. For a person with type 2 diabetes, however, one of two things are happening that is preventing glucose from getting into the cell. So, either there is not enough insulin to move this glucose from the blood into the cell, or the insulin that is being produced is not functioning well. And because it's not functioning well, it is not able to do the work that it's supposed to do of carrying that sugar, glucose, into the cell. When this occurs, we call it insulin resistance. Insulin resistance results when fat blocks the connection between insulin and the cell, and this prevents the insulin from doing its work of moving glucose into the cell. Some conditions that put persons at risk for insulin resistance include being overweight or obese, polycystic ovaries. Women with polycystic ovaries are at risk. People with metabolic syndrome. Metabolic syndrome is a combination of high triglycerides, low HDL cholesterol, high blood pressure, and a large waist circumference, 40 inches and more for men, and 35 inches and more for women. Now, because insulin resistance prevents insulin from carrying glucose into the cells, glucose continues to build up in the bloodstream. This triggers the pancreas to produce more and more insulin because it wants to get the sugar into the cells. Eventually, the pancreas becomes too tired of producing insulin. As a result, the production of insulin falls, leading to even higher blood glucose. Some symptoms of high blood sugar include tiredness, frequent urination, thirst, hunger, and not only hungry, craving for sweet things, blurred vision, wounds that won't heal, and burning and tingling sensation in the feet, just to name a few. It's important to understand that some people may say to you that I don't get any of those symptoms. Some may be having the symptoms and don't even notice them. While there's still others that have the symptoms, they recognize the symptoms, but they don't consider those symptoms as important enough to pay it any attention. Because of this, people can live with type 2 diabetes for up to 10 years. Yes, you can live without diabetes without knowing that you have diabetes. You can live with diabetes for up to 10 years without even knowing that you have diabetes. By the time you recognize that you have diabetes, the excess blood, sugar in the blood, would have caused so much of damage to your heart, your eyes, your feet, your kidneys, and all of these are what we call complications of diabetes. Diabetes can be prevented. It can be controlled, and these complications we just spoke of can be prevented with the right management. Management of diabetes includes what is not limited to medication. Talking with a diabetes educator allows you the opportunity to identify the areas that put you at risk for diabetes or its complication, which will allow you to have a plan that best suits your environment and your situation. Visit our website at amcec.net. amcec.net to learn more about diabetes management and the services that we offer for diabetes, high blood pressure, cholesterol, and others. While there, sign up for our free 30-minute consultation where we will help you to identify the areas in your diabetes management that you need to focus on, and also help you to devise strategies where you can implement to meet those needs. That's it for now. See you next time when we shall look at our next topic, gestational diabetes, diabetes in pregnancy. And remember that healthy lifestyles begin with a choice. Don't forget to like, comment, and subscribe to our channel so that you will be notified when our next video is out.